Hello. Today we are going to talk about constipation. Constipation is a very common problem, especially in the modern world, because of our eating habits, because of less fluid intake, because of less physical activity. First of all, we will discuss the term constipation. So we need to take in mind that constipation is actually only a symptom. It is not a disease. So it is a symptom and not a disease. So we always need to find out what is the underlying cause of constipation. There is also another term that we need to discuss, and that is obstipation. These terms are similar, but they are actually very different. In constipation, people have difficulty passing the stool, maybe less frequent, maybe difficult to expel hard stools, incomplete evacuation, and so on. But in obstipation, there is actually no passing of stool and no passing of gases. In constipation, there is always at least some passing of gas, but in obstipation, there will be no gas. And this is a more severe term, a more severe problem than constipation. So, constipation, what is its definition? So, it is defined as less than 3 stools in a week. So, in 7 days, we have less than 3 stools. But the definition is more complicated than this. There can be people that have 5 to 6 stools, but they are hard stools. They feel incomplete evacuation after the toilet. They have abdominal bloating. They have difficulty expelling the stool. They feel a fullness in their tummy. And all that are criteria when we have those patients that are considered constipation. So constipation is a symptom that it is very subjective. But all these complaints together can constitute that we diagnose that the patient has constipation and a problem with stool evacuation. So how are we going to tackle this problem? First, constipation can be divided in primary. So in this case, this is our gut, the small and the large intestine, the rectum, and the anus. So this is a normal, physiological, anatomically and physiologically a normal gut. But if the patient has problems and constipation and there is no underlying cause, that is thought as primary constipation. So we will just put it like this. So primary constipation, or it is also called functional constipation. More than 90% of the cases of constipation are actually this type of constipation. And that is good for us because this is easily solvable. Most cases of constipation are actually problems with the diet. So a low fiber intake, a low hydration, a low activity, sedentary lifestyle can easily lead to constipation, but it is easily solvable with taking veggies, taking more fluids, and doing a little amount of regular exercise, and there will be no constipation. But there is also a second issue that we need to address, and that is secondary constipation. As the name says, so secondary constipation there is an underlying cause, and the constipation is a secondary symptom of it. The constipation as an underlying cause that has an underlying cause, it has many causes. I only put here the most frequent ones. So we will start from the anal region problems. For example, here we see that there is a tear in the region of the anus. So this tear is actually called an anal fissure. This is one of the problems. Why do patients with anal fissures develop constipation? Because when they pass stool, they irritate this fissure and they have pain. Because of this pain, they avoid going to the toilet. So because of that, they develop constipation. Also, here we have, these are hemorrhoids. So these are internal hemorrhoids that are in the anus, and when they are out of the anus, I will just say it like that, when you can see them, they are external hemorrhoids. So these are internal and these are external hemorrhoids. Internal hemorrhoids do not cause most of the time pain, but external are painful. So as in the anal fissures, hemorrhoidal disease which is also fairly common because of the sedentary lifestyle, causes pain when the stool passes, and then the patients avoid going to the bath, and then they have constipation. Then we have problems with obstruction. So one reason. Then we can have problems with obstruction in the gut. So if it is a part of our bowels, we see that here is a mass. This is obviously a tumor. It is not important if the tumor is benign or it is important, but the important thing is that there is a mass that is obstructing the normal evacuation of the stool through the anus. And this obstruction obviously leads to constipation and problems with stool evacuation. Of course, there will be other signs, like in all of these other causes, but constipation is just a symptom in this secondary constipation of an underlying problem. So tumors and strictures and other problems that cause the normal gut anatomy to change can cause obstruction and then a symptom that is constipation. Then we have another interesting cause, and that is irritable bowel disease. So irritable bowel syndrome. Irritable bowel syndrome is actually an interesting disease that has in constipation that is primary, we don't have pain. And in the irritable bowel syndrome, we have many symptoms, but there is a form of irritable bowel syndrome that is called irritable bowel syndrome that is dominantly, where the dominant symptom is constipation. There are other symptoms, but constipation is one that is dominant. So it is also important to know that there is a very similar disease to primary constipation. Then a very, very important cause of constipation, medication. So there are many, many different medications that can give problems with constipation. For example, calcium channel blockers, many antidepressive medicine, and of course a big group opioid medicines. So they will definitely, if they're taken for a longer time, they will definitely give problems with stool evacuation, and they will definitely have a problem, these patients, with constipation. Also, patients that abuse opioids, they always have some laxatives with them. Then we have many endocrine problems. I put here the thyroid gland. So the dysfunction where we have the loss of the function of the thyroid gland. So hypothyrosis can also give constipation as one of the symptoms of the dysfunction of the thyroid, for example. That is one option. Then we have neurological diseases that often can give problems, and there are many of these diseases. So in neurology, we have many diseases like Parkinson's, like multiple sclerosis. There are also muscle atrophy diseases that all can give problems with stool evacuation and can cause constipation. And in the end, obstipation. So constipation can lead to obstipation. There are also psychiatric diseases, so like depression. People that have depression will be using antidepressive medicine, and that is one option, but also because of the disease itself, they can have a problem like constipation. Then food disorders, who doesn't take food in will have no stool. That is a no-brainer. So basically, this is an overview, and it is good for us that most of the causes of constipation are actually primary and easily solvable with change in a diet where we take more fiber and where we hydrate better, and where we do more activity. When when a patient comes in and we do an anamnesis, when we do a clinical examination, those are a must. And if we don't find an underlying cause, we definitely do this therapy, and in most of the cases it will solve the problem. But if we find there is a bloody stool, there is weight loss, there are other symptoms that can be thought to be problems with the thyroid, some Parkinson problems, and so on, there will be other symptoms besides constipation. We need to do more diagnostics and probably consult more colleagues to see what is actually the primary cause of this secondary constipation. It is very important for people that have constipation and that have also a bloody stool, and especially if they have weight loss and anemia, and especially if they are older than 40 years. So in those patients, it will be also a no-brainer to do more diagnostics, especially colonoscopy. So in order to recap this, it is good for us that most constipation actually arises from our lifestyle and our lifestyle problems, and it is easily solvable. But there are also many secondary causes, and I have not addressed all of them. There is also colonoparasis, problems with the anal floor muscles, and all of those causes, anal fissures, different benign and chronic tumors, different diseases in the GI tract, systemic diseases, and so on. All of them can cause constipation, but in those cases, constipation is only a secondary symptom of an underlying cause. Thank you.